Joining me today as the co-moderator of this session is my friend, colleague, and longtime academic partner, Dr. Giselle Corby-Smith. Dr. Corby-Smith is a professor at the UNC Department of Medicine. She's also the director of the UNC Center for Health Equity Research and is the co-director of the Robert Wood Johnson Foundation Clinical Scholars National Leadership Institute. We appreciate, again, all the positive and supportive comments and emails that you've received us. And again, we want to acknowledge and just say that we appreciate your commitment to our work. Dr. Corby-Smith, would you now share with us our ground rules?
So I'll start with our learning objectives for this webinar series that we started several months ago, just at the height of the pandemic, and they remain the same: to share diverse perspectives on this pandemic and its impact on health equity, to develop a network to support systemic changes in response to COVID-19, and to explore the collaborations and partnerships in promoting equity and the response to COVID-19. Before we start, we do have a few ground rules. Your audio and phones will remain muted for the duration of the call. However, we've left the chat box open so that you can freely interact with both the panelists and the entire audience through the chat box. The questions to our speakers, though, should be placed in the Q&A box because we have almost 250 people on our webinar and several other number of people on FaceTime. We want to be able to manage the flow of requests and information and questions. So please use the Q&A box because we can't really monitor the chat box for questions. This webinar is being recorded, and this and prior webinars are available on the CCPH and the CHER website for review and to share with your networks. This is a resource that we want to provide to our community. We are aware that, though, that hackers have successfully accessed Zoom webinar to distribute disturbing images and offensive information. At any point that we are aware that such attempts are being made to this webinar, we will immediately suspend the session, and we apologize in advance for that. We believe that such action is going to be necessary to minimize any further dissemination or exploitation or discrimination in that context. So with that, I'll send it back to my colleague, Mr. Al Richmond.
Thank you, Giselle. So I want to set the stage today for our time together by just kind of reminding you about the theme for today's webinar series, and it's entitled Ensuring Equity and Justice During the Pandemic and Beyond, Lessons from the Poor People's Campaign Health Justice Advisory Committee. In terms of background, you'll hear more about this. In March, the Poor People's Campaign, which is a national call for moral revival, convened the COVID-19 Health Justice Advisory Committee to advise the movement's efforts to ensure a just and equitable response to the COVID-19 pandemic and other issues even beyond this moment. We want you to join us in welcoming today to the webinar series my good friend and colleague, Dr. Sherelle Barber. Sherelle, in thinking about today's session, and I was reminded again of another quote by John Lewis, and I want to share that in introducing you, because I think that you and those community organizers who have joined you, this means so much to you and it resonates deeply within you. And it says, and these are words of John Lewis, it says, "Do not get lost in a sea of despair. Be hopeful, be optimistic. Our struggle is not the struggle of a day, a week, a month, or a year. It is the struggle of a lifetime. Never, ever be afraid to make some noise and get in good trouble, necessary trouble." Dr. Sherelle Barber is that kind of person. I've known her for a number of years, and it's a delight to welcome her today and to have her lead us in this most important conversation. Dr. Barber is assistant research professor at Drexel University in Philadelphia. She is also works at the research level, looking at multi-level analysis and spatial techniques, and draws heavily from theories that take a social ecological approach to understanding health and health equalities. Ultimately, Dr. Barber hopes her research will inform the development of multi-level, multi-sector policies that will address the underlying structural determinants of health through economic and social policy initiatives. I'm so excited. I met Sherelle many years ago during her undergraduate work. And at that time, she was moving through Bennett College for Women in Greensboro, North Carolina. And she's a proud Bennett Bell alumna. And then on to the University of North Carolina at Chapel Hill for her master's in public health, and culminating her studies at Harvard University in a Doctor of Science. So Sherelle, I am so excited to welcome you today. You know, I love you and we're so proud of you. I also want to celebrate with Sherelle that on yesterday she received her first R1. And for those of you who are in the academy or work with academic partners, you know that this is the gold star, if you will, the culmination of what every scholar in the academy is working for, to receive their first R1, which we know will be the first of many that you will receive. Welcome, Sherelle, and welcome also to your colleagues today.
Thank you, Brother Al, and I call you Brother Al. You've been such a mentor to me, and thank you too, Giselle, for just the opportunity to present with you all today. Both of you all have just been such mentors to me, and I'm grateful for this opportunity. I'd like to take the time to also introduce, or just mention, and I'll introduce a little bit further, Reverend Erica Williams, who is an organizer with the Poor People's Campaign, and Ms. Laurel Ashton, who are both going to share with us during this time. So this is going to be a little bit, me presenting, and then I'm going to actually open it up to more dialogue and conversation between myself and Erica and Laurel to talk about the Poor People's Campaign more broadly. And so I'm going to share my slides. Hold on just a second. And all right, so I want to, like I said, I'm going to talk to you all about the work that a group, myself and a group of scholars have been doing with the Poor People's Campaign, and really the lessons we have learned over the course of the last 4 to 5 months as we've engaged with a movement that really was in place before this crisis, but really was called to this moment to really demand, if you will, a moral, a just, and equitable response to the pandemic. And so just a little bit about the Poor People's Campaign, a national call for moral revival. I'd first like to just acknowledge the co-chairs of that campaign, Reverend Dr. William Joseph Barber II, who also happens on most days to be my father, and Reverend Dr. Liz Theo Harris. Both of these leaders have been doing work among marginalized communities for decades. Reverend Barber in North Carolina, starting with HK and then the Moral Mondays leading into the Poor People's Campaign, and Reverend Dr. Liz Theo Harris doing work in poverty. She grew up in Wisconsin in a working class family and has been doing this work for years. And 2 years ago in 2018, their paths really crossed, and they decided to revive what had been Dr. Martin Luther King's final kind of campaign or push before he was assassinated. And that push was really to unite across racial lines poor people across the United States. He had led, and with so many others like Representative John Lewis and so many other grassroots organizers, the work of the civil rights movement. But in his latter years before he was killed, he saw a need to really address the deeply entrenched economic issues that, again, cross racial lines, but were also very deeply rooted in systemic racism, systemic poverty, and militarism in this country. And so 50 years later, the Poor People's Campaign in its current form decided to carry on that mantle, that baton, to really talk about the interlocking injustices of our day, which are still systemic racism, systemic poverty, ecological devastation, the war economy, and also this false narrative, that's really rooted in Christian nationalism, right? And it in 2018 kicked off in Washington, D.C., a march that would then lead to 2 years of organizing across the country to really bring on existing grassroots organizations from 45 states across the country to really tackle these issues both at the state level and the national level. And so the Poor People's Campaign was born, and it has done amazing organizing work that Laurel and Erica will talk about, that has, one, helped to shift the narrative. And as my father says, they've done that by shifting the narrator. Again, making sure that it's not just, quote unquote figureheads talking about these issues, but really directly impacted individuals, from communities from Alabama to California to New York, really mobilizing and sharing their stories to really shift the narrative about poverty, about systemic racism, about ecological devastation. And also to develop a policy agenda, a radical policy agenda that directly addresses these interlocking injustices. The argument of the Poor People's Campaign is that, it's the policy violence over decades in this country that have created the kind of devastation in terms of poverty, in terms of racism. And if we can create policies to create these conditions, then we can also create policies to undo and restructure and radically restructure this society. And it's necessary because, as we've seen with this pandemic, there were so many inequities prior to the pandemic that are only being exacerbated and made worse because of it. And so here are some of the numbers. If you look at the federal poverty line, 41 million Americans live below the federal poverty line. But again, the Poor People's Campaign argues that this is a gross underestimation of the real true nature of poverty in this country. And in fact, if you expand that out, it's more like 140 million poor and low wealth Americans in this country. That number is striking, and it shouldn't be in the wealthiest country in the world. We also know that before this crisis, that there were 30 million uninsured individuals. Again, the lack of the lack of will on a part of the leaders in this country to expand healthcare to everyone. And we know, again, that during this pandemic, that has been lethal, literally, that people do not have access to adequate healthcare. The Poor People's Campaign also commissioned a study by Columbia University that found that 700 Americans a day before the pandemic were dying from poverty. We talk about, causes of death because of heart disease, stroke, et cetera, but 700 Americans a day were dying from poverty before the crisis. And so what the Poor People's Campaign, really early on in this pandemic said, there was a crisis before the crisis. And we have been highlighting that crisis in areas across this country. And now in this moment, we have to position ourselves to demand a just and equitable and a moral response to this pandemic. Because again, before numbers begin to emerge on inequities, before we saw the statistics, based on what we know about how COVID-19 is transmitted, how people are exposed, and who's more likely to die, we knew that this was going to have a devastating impact on the most marginalized communities in our country. And so the Poor People's Campaign did a webinar on the kind of a moral response to the pandemic, and then decided that they wanted to bring along scholars, public health scholars, to really, help them shape and frame their response, rooted in statistics, rooted in the best public health practice, and rooted in our current knowledge, and again, our strong, a deep sense of justice and equity. So, so myself, along with some scholars, which I'll introduce shortly, joined on because we saw this as an opportunity. So we really saw, our committee as having an opportunity, based on the structure of the Poor People's Campaign, one being led by directly impacted communities, having, dozens of national religious organizations, as well as other national partners across the country, widespread media relationships with national media, policymaker relationships, a strong social media engagement, student fellows, as well as 45, if I'm not, correct me if I'm wrong, Laurel, state coordinating committees around the country. So we saw this as like the way we could have the most impact early on in the pandemic to really push some of the kind of health equity, health justice messages, along with some of the data in order to really shape the narrative early on in the pandemic and really push policymakers to act in a moral and responsible way. And so colleagues at the Harvard FXB Center for Health and Human Rights, led by Dr. Mary Bassett, and the UCLA Center for the Study of Racism, Social Justice and Health, led by Dr. Chandra Ford, decided to come on as two kind of grounding academic entities, along with other scholars who had expertise in epidemiology, infectious diseases, et cetera. And so we would provide, in many ways, the kind of health equity expertise, as well as some research infrastructure to be able to inform the movement during this moment. And these are the wonderful folks that came alongside the Poor People's Campaign. Again, honored to be a part of this movement because, I know when, things started happening early in March, in some ways you feel powerless and helpless. But by bringing together this group of scholars and then joining up with an existing movement, it felt like that we were making an impact, that we were actually having some impact on the conversation and being able to shape that narrative early on. So it's been an honor to work with these, sister scholar friends, in our networks to really be able to shape some of the work of the Poor People's Campaign during this moment. And so really our mission was to provide as much as possible timely, relevant health equity expertise to the steering committee as it made demands on mostly national leaders, but also state leaders as well. And so, so we were, gleaning the literature, gleaning some of what was coming out in terms of some of the data on the disproportionate impact, on what the best public health practices and the best data-driven policies would be. We were also helping to provide expert commentary. So we supported clergy members across across the country when the data were emerging on racial inequities, particularly among Black communities, and other places where we've written op-eds or joint op-eds, et cetera, to really just, again, shape this narrative and provide some expertise there. And then we also, like I said, compiled as much data and research as we could so that the PPC, my Reverend Barbara often says, it's bad to be loud and wrong. And so in this moment, wanted to make sure that we were rooted again in the science, but again, with an equity and a justice lens. So it was really important to bring all of that together to be able to shape and inform the movement. And this was the joint statement that we made in early April after we formed, and we were moving relatively quickly. But we called out the US response. We said the US response to the COVID-19 pandemic has been reckless and uncoordinated, leading to the country's current status as the global epicenter of the pandemic. And as of April 7th, confirmed cases in the United States surpassed 300,000 with over 10,000 deaths. And we noted that without an explicit attention to health justice, COVID-19 will reinforce existing health inequities along racial and economic lines. We went on to say that really, none of us can be assured of wellness unless all of us are. And our argument was that if this nation and states and communities didn't center equity and didn't center justice, we actually further the pandemic, right? So the extent to which we think it's just those communities over there being disproportionately impacted without realizing that we're all interconnected. And especially when you're dealing with a virus that's that has high levels of transmission, you know, you can't think of this virus as just impacting those folks over there, because we're all interconnected. And this is one of the major points that we try to make throughout our work, is that you have to center equity and justice in this moment. Otherwise, we don't get this pandemic under control at all. And so some of the activities, again, we've provided media talking points. We helped out with press conferences. We created joint statements. In addition to this open or kind of initial joint statement, we also did a really strong statement on why states shouldn't be reopening. And unfortunately, states didn't listen to that, or others who were making similar calls. And what we're seeing is what we expected: this surge of cases throughout the country. And again, poor communities of color being most devastated by our rush to reopen without ensuring, you know, again, equity and justice. We also did congressional briefings with members of the U.S. House and the U.S. Senate. And it was surprising, at least to me, you know, the extent to which, you know, our elected officials really wanted this information. You know, there was, you know, just a basic understanding of what was happening so they could make the proper policy decisions. Whether or not they did it, you know, that's another thing. But, you know, folks were open to listening. There were 3 digital mass meetings, which were powerful. These were meetings that were already planned as a part of the lead up to what was the June 20th campaign to really mobilize, which was supposed to be a physical march on Washington on June 20th, but became a digital mass gathering. But these digital mass meetings were really powerful because, one, we got to hear from states across the country. And we were hearing some of the same stories about the impact that the pandemic was having. And so, again, the things that we knew because of our expertise as scholars were being reaffirmed by the stories we were hearing right on the ground. And that was another key element of being a part of this, was having a pulse on the ground among the organizers who are really just, you know, experiencing the devastating impact firsthand. We also hosted a listening session of directly impacted leaders. Again, this was really powerful because, you know, I remember when we had this session, and it was one of those days where just seeing the deaths and reading the statistics and just, you know, being kind of consumed by that was really weighing heavy on myself and so many of us. And we get on this call with these directly impacted folks, some from Alabama. We had folks from Michigan, California, New York, and they were fired up. They were not, you know, depressed and down. They were fired up. They were doing the work. And yes, of course, it was hard work, and it's tough when you have to constantly fight to survive. But they were fighting and they were standing, and I almost felt ashamed that I even came into the meeting. Oh, woe is me, because, you know, these folks were, you know, literally gave us life, you know, as they were speaking, both about the pain, but also about the power. And I think that's really critical as we engage communities. We also supported work of the Fight for 15, which is a grassroots movement. They wrote a letter to McDonald's headquarters and their CEO, because early on, and still to this day, you know, corporations like McDonald's are not providing personal protective equipment, paid sick leave, the kinds of things that are necessary to put in place if we're really going to mitigate the spread of the virus. And then finally, one of our last things we did before we took a short recess was doing a mobilizing statement for the June 2020 digital gathering, which ended up attracting over 3 million viewers, you know, since it's been up. I think 2 million on the day of. And really was, you know, our way of supporting the larger movement, because, you know, we were brought on to really kind of talk about and to support, you know, the movement's response to the pandemic. But again, even at the beginning, and as we continue to work with the Poor People's Campaign, it was clear that this moment requires a movement. And there's no public health remedy that is going to supplant the need for that. Yes, we need the public health strategies, absolutely. Yes, we need to make sure we're highlighting things like testing and contact tracing and making sure things, get, the resources that communities need are available. However, if we're gonna really address these underlying inequities, we have to have a social movement to really move the needle on the fundamental drivers of the inequities, because that's really, what's driving what we're seeing in terms of disproportionate rates among Blacks, Latinos, and Native Americans, disproportionate rates among poor folks, the ways in which we're ignoring homeless populations and those who are in prison and in detention centers, those marginalized folks that we think are disposable in this moment, but we have to, again, move the needle. So this is a moment where we can push this conversation, and COVID-19 is just the latest example of how deadly these inequities can be. And so I'll just list a few lessons learned, because I really want to hear from Laurel and Erica and give you all an opportunity to hear from them about being a part of this movement for so many years. But these are a few of the lessons that I've learned and gleaned from this process, continuing to, refine, how we engage with this work. But again, seeing it as absolutely necessary if we're going to deal with the pandemic and beyond. So the first one is the power of leveraging collective scholarship and activism. Again, there were 8 of us from a wide range of university settings with different levels, different expertise, and different kind of involvement in kind of the response and leadership experience that could, again, inform the work. And all of us, brought something to the table, and it refined our thinking about how these inequities were playing out and what was needed to address them. So I really think that this was a powerful, this was really powerful in displaying how collective scholarship and activism can be leveraged in a crisis like this pandemic. Every movement needs footnotes. So I think as scholars, sometimes we think that, we can't really engage, with these kinds of processes, but that's absolutely not the case, and it can't be the case. Our research isn't any good unless it gets put to use. And, Reverend Barbara often says that every movement needs footnotes. If you go to the Poor People's Campaign webpage, you'll see that every policy they have, every point that they make is footnoted. And that was one of our jobs. We were providing the footnotes. So the research is important. The data is important, because the data then shapes their arguments in the media, with policymakers, et cetera. And so sometimes they rattled off more data than we did. And it was, and again, absolutely necessary. And so again, for folks who've had this dichotomy between being a scholar and being an activist, it doesn't have to be that way. And the research itself can be a form of activism, which I think is really powerful. The other piece that we tried to help with was just framing the health and the economic issues as interconnected. One of the points we made early on as a committee is, if you don't get the health piece right, the economics, you won't get the economics, and vice versa, right? And so as we're thinking about, where we are now, with millions of people being unemployed, with millions of people facing evictions, with millions of people losing their health insurance because they're now unemployed, those economic kind of ramifications of the pandemic are going to wreak havoc and cause the pandemic to be even more, have even more devastating impacts in our community. So what we've noticed from the national conversation is that folks were trying to separate the two, as if you can just deal with the economics, but you can't. And then the public health expertise was absolutely necessary, because we needed to tell folks, like, you have to increase testing, you have to increase contact tracing in an equitable way. And if you don't put that public health infrastructure in place, your economic, plans are also not going to, be have the impact that you think. So again, they have to be seen as interconnected, and you couldn't develop piecemeal policies. They need to be joint policies that were implemented at the same time. And we're actually seeing, where we focused on one more heavily than the other as actually having more devastating impact. Engagement with the political process is not an option, but a necessity. I think, again, sometimes we shy away from quote unquote politics. But in this moment, and there is a danger, of engaging with the petty politics, the partisan politics. But in this moment, when people's lives are on the line, we have to be able to communicate and take a stand. We have to say things are right versus wrong, and there are policies that can make these inequities, better, right? And so I don't think that this is not a time, especially given not only the pandemic, but also the police killings that we've seen, the murders of Breonna Taylor, of George Floyd, and so many countless others. This isn't a time to kind of be lukewarm or being straddling the fence. We have to figure out a way to engage the political process, because along with those most directly impacted, because it's really not an option. And it literally is a matter of life and death if we don't do this. And so I think it's important for us to figure out ways to do this and link up with, again, existing movements on the ground. Another important lesson for me was just recognizing both the pain that is being experienced, but also the power. And again, a lot of times in public health, we can use this language of vulnerability, which I have shied away from for some time now, because what I've learned from just observing and being a part of this movement is that there's so much power in communities, and communities have been fighting and struggling long before this, and they will be fighting and struggling long before, long after COVID is over. And they do experience the pain, and it is devastating in sometimes, but they also exhibit a level of resilience and resistance that, again, inspires so many, me and so many others. And so I think, again, reminding ourselves that poor communities of color aren't helpless, vulnerable communities. They've just been devastated by the policy violence, that exists in this country. And so, again, I think a reframing and a restructuring of how we even view certain quote unquote marginalized communities is so critical. And demanding equity and justice is a constant struggle. And so again, naively, I think I was like, okay, if we do these 1, 2, 3, 4, 5 things, of course, people will see the light. Of course, policy makers will make the right decisions. And, so we were doing all this work, and, we're here in August, and there's still not a fourth relief bill that would, again, address these deeply entrenched inequities. And for me, it was just a reminder, that this is a constant struggle, and you have to constantly be in movement, right? Movement building, organizing, which is why, again, this is the power of the Poor People's Campaign. It existed before the crisis, so it was in position to then help shape, the conversation and demand certain things. But like I said, it will be here beyond the crisis and be addressing, the inequities that exist. And so, this fight, this struggle that we're in is a continual one. And we have to figure out ways to constantly engage the process and not, look for instant gratification, but just, really pushing the needle forward. And then one very heartbreaking lesson was our failure to act justly is being measured in lives lost. And so this is a picture of one of the organizers with the Poor People's Campaign, Miss Pamela, who was from Alabama, and she was broadcast on the June 2020 digital mass gathering, shared her powerful testimony with members of Congress back in, I think it was 2019, lives in a rural area right in Alabama, experiences ecological devastation, environmental racism, poverty, and so many different other things. And she became, just a few weeks ago, a casualty of this pandemic. And so up until the time of her death, she used her voice to amplify these issues, and the very injustices she was speaking out against claimed her life during this pandemic. And so we have to do this work. It's literally a matter of life and death. We have no option, no choice. And these are the reasons that myself and other scholars and others, organizers around the country, are doing the good work of the Poor People's Campaign, because we know, again, that these interlocking justices of racism, of poverty, systemic poverty, ecological devastation are all deadly. And we have to, in this moment, if no other moment than this moment, take a stand. And so in our call to public health colleagues for the June 20th, we wrote this statement. We said, movements from the bottom up have historically led to progress. In this moment, we answer the call to speak out against oppressive systems and institutions that have created the unequal and unhealthy world in which we live. Justice demands it, and our collective lives depend on it. We hope you will join us in this fight. And so this is a continuous call to folks in the public health community that this is really time for a movement in this moment, and to really stand alongside those who are already struggling, both in the streets, but also in so many different other ways. It's our time. And I, as someone who came into public health because of a deep sense of social justice, I don't see, it really is, there's a fierce urgency about this moment. And so I think along with all of the, the necessary public health work that's being done around, research and scholarship and the things that need to be done kind of in the immediate moment with regard to testing, with regard to contact tracing, with regard to making sure our healthcare system isn't overwhelmed. All those things are necessary, absolutely. And we need a movement if we're really going to push the needle and, and mitigate inequities and eliminate inequities, both in this moment, during this pandemic, and beyond. So out in there, and actually want to now bring on two wonderful, amazing organizers with the Poor People's Campaign. They are the reason that the campaign has a heartbeat, has a drumbeat. They do the hard work of organizing, which they will describe as not easy work, but it's necessary work. And so I'm so honored that Laurel Ashton and Erica Williams are joining me today. And as good organizers, they of course have some work to do after this call, so they may have to jump off early. So I'm gonna actually hurry up and turn it over to them, get them started in conversation, so that we can hear from the ground, hear from the folks who are doing this good work. So thank you. All right, so like I said, I have Laurel Ashton and Erica Williams. Just a little bit about the two of them. Laura grew up in Western North Carolina. She actually began organizing alongside campus workers at UNC Chapel Hill and Duke University for better working conditions. She's worked as a field secretary for the North Carolina NAACP from 2013 to 2017. She also helped to organize Moral Mondays, which were held in Raleigh, North Carolina. And then now she is currently the organizing director for the Poor People's Campaign, a national call for moral revival. And Reverend Erica Williams is the National Social Justice Organizer with Repairers of the Breach, which is one of the organizations that out of which the Poor People Campaign comes. And she's from Michigan, from Saginaw, Michigan. And she is, she's committed to this work of justice, and it's really summed up in the scripture, Luke 4:18, the Spirit of the Lord is upon me to preach good news to the poor. So I'm just, again, honored to have the two of them on today to just share with you all their experience with this work. So Laurel, Erica, I'll just start off by asking the two of you to tell us about just generally your involvement with the Poor People's Campaign, and really how's it impacted you personally, but also how has it shaped, how you engage in this social justice work? So we can, either one, Erica or Laurel can start.
Reverend Erica, why don't you get us started? All right, I'm gonna kick it off. Thank you so much, Dr. Barbara. I don't know what an R1 is, but I am thrilled that you just got one. Congratulations.
Thank you.
I am just really pleased to be here and appreciated that slideshow because I think it touched on so many really key points that I think it's important for us to make about the campaign, and particularly speaking to a group of health scholars here today. I hope that we can begin this as an invitation into the campaign, into the Poor People's Campaign. Welcome in. We need you. We want you.
Absolutely.
I'll just say, I've organized around this principle of moral fusion organizing for a long time at this point, beginning my understanding of it beginning with Moral Mondays in North Carolina, and then certainly has deepened as I've become involved in the Poor People's Campaign. And it's an understanding that we need to build mass movement in this country if we're going to make systemic change. And we need to do that in a way that is organizing across lines of difference and historical division. So that means across race and geography and gender and ability and sexual orientation, gender identity, all of the differences that we can embody, we have to come together across those if we're going to make systemic change, that it will take all of us. And it also is an understanding that we have to shift the narrative in this country, that we have to not understand this as left or right issues, as Democrat or Republican, but as moral issues. You know, this is about what is right and wrong. We're talking about 700 people a day dying. Before the pandemic, we're talking about 140 million poor and low-income people, and an expectation that that's going to increase by 50% because of what has happened. This is a moral issue, and we have to reclaim that narrative. We also have to shift the narrative of what we understand about poor people as agents of change. Dr. Barber, I thought you spoke really well about that, kind of talking about this pain and power. With the Poor People's Campaign, we also talk about the fight, the plight, the fight, and the insight of poor folks. So the plight, yes, we have to understand the conditions. Like, that is central. But so often people stop at the conditions. They stop at the stories. There's also the fight. It is poor people leading this movement. We are organizers on the ground making this happen. And the insight, those who are being hurt, those who feel the pain of public policy, we know when the pain stops. So we know the solutions. And what I really appreciated about the role of the Health Justice Advisory Committee was that there was an understanding and an acknowledgement of that. You know, that listening session I thought was so important, because we need folk who got the data. We need people who have that information. And also regular folks, we are the experts of our own lived experience, and that has to be in conversation. You know, policy development and this information can't stay in the academy. It has to be in conversation with movements. It has to be, you know, policy is really important to how we think about the work. We have done an audit of America, hundreds of pages of information there, looking back over the past 50 years. We've done a budget looking at, okay, what are our demands, and can we actually afford this? And of course the answer is yes. And yes, it would save us lots of money long term. You know, we do a lot of digging into the numbers, but that doesn't happen separate from power building, from base building. That they motivate each other forward. They work together, so that we can really be building long-term power. So I know that doesn't exactly answer your question, but I just got all of these thoughts coming from your presentation. And I'll just say that, you know, what has been so transformative about the experience of being part of this movement, one thing, because all of it is, you know, I'm changed as a person because of my involvement with the Poor People's Campaign and all the work that led to it. But, you know, being somebody who grew up in Western North Carolina, being a white woman, I think what was also really essential is understanding, we talk about systemic racism, poverty, ecological devastation, the war economy and militarism, and the distorted moral narrative of Christian nationalism. It's a mouthful. And we are a Poor People's Campaign, but we start with systemic racism. We always name systemic racism first. And it is because systemic racism is being used to reinforce and maintain all of those systems. The reason why we don't have healthcare for all today is because of systemic racism. You know, the reason that policy violence is inflicted, it is not because it's an attempt to only hurt Black people through the policies, but racism against people of color is used to ensure that those policies are not put in place. And so we have to understand that white people, our stake is all up in this. We are not in this as allies. We are in this because our lives depend on it too. You talked about Pam. Makes me want to cry just thinking about how she died right after June 20th. And just yesterday, we heard about Dred McCall with the National Union of the Homeless, who passed away from COVID. You know, our people are definitely part of the numbers that are dying. And it is white people also, but we have to understand the role that systemic racism is playing in these deaths, all of us. And what I think is so powerful about the campaign is, you know, when you understand that your life depends on it, that you have a stake in it, that you're not in this because you're an ally, but you're in this because your life needs it too, it changes your understanding of a lifetime commitment to the movement and of being in this for the long term. So I'll just pass it on to
That was so powerful. Thank you so much. Reverend Erica.
So thank you all for being here today. And so I come following that brown-skinned Palestinian Jew. When he stepped on the scene, he said, "The Spirit of the Lord is upon me, for he has anointed me to preach good news to the poor, to heal the brokenhearted, to set the captive free, and to proclaim the acceptable year of the Lord now." And then he closed that book and he said, "The message has been fulfilled in your hearing today." They said, "Who could say that?" He said, "The Messiah." And he went about setting that thing off. And the way he set it off, I believe, is he started the original Poor People's Campaign. And the disciples that followed him, one of them, a lot of them were in the medical field too. They were the ones who set about setting this change in order. And so I see the Poor People's Campaign, a national call for moral revival right now, continuing that work that was started over some 2,000 years ago in an effort to change the systems that continue to perpetuate systemic racism. As my colleague Laurel said, poverty, ecological devastation, the war economy, and that Christian distorted moral narrative that says that some shall have and some shouldn't. And so the Poor People's Campaign is so critical. And I love what Dr. Barber said earlier about King's last initial campaign he did before he was assassinated. Let's be real clear. They didn't kill Dr. King because he had a dream. They killed him because he had a plan. And that plan was the Poor People's Campaign, because they saw that bringing the economic, bottom together to organize across lines of division would really help to bring systemic change in this nation. And so I'm just grateful to be a part of this work. I'm grateful to be on the right side of history, because what I do know is, as Dr. Barber and Laurel said, it don't matter if you're left nor right, because ain't neither right. It's all about knowing what's wrong. And so I'm a native of Saginaw, Michigan, right next door to Flint, Michigan. And I want y'all to hear me loud and clear right now. It's been 6 years since folks in Flint had clean water. I still got family members drinking bottled water to this day. So it ain't what I heard, it's what I know. And people are still being impacted with so many health ailments because of the water being switched from the Detroit River to the Flint River. And I want you to know that GM, General Motors plant there, would not use that water because it was rusting the parts on their automobiles, but they gave it to people. So that lets you know exactly how they felt about folks. So what we say is, when you po, that's in the words of Reverend Andy Chamber, one of the original Poor People's Campaign organizers, when you po, because you can't afford the O and the R, they don't care nothing about your life, and they will allow for you to die. And so I'm so grateful to be with this campaign, you all, because I tell you with all of my heart, I know that this is the moment. It ain't just Christians that need to do it. It can be Jews, it can be Unitarians, Buddhists, all of us, but even people who have the belief off the Constitution that we are to promote the general welfare of all people. We got to go to work, because this nation has been doing this since it was started. This past 4th of July, I was really, reflecting on what Frederick Douglass said, what is a fourth to a slave? And I said, what Frederick said back then is still very relevant to this day, because people still ain't free. And it ain't a matter of just being Black. As Laurel said, yes, Black folks and brown folks and First Nation folks get it first. But please know, in this country, even white folks, let's be real clear, they getting hit hard, because in that 140 million poor low-income folks, 67 million of them are white. And y'all know after this pandemic, it's going to get even worse. And so I'm just grateful. I'm just grateful that folks are waking up. We need the academicians. We need the healthcare providers. We need the clergy. We need the lay leaders. We need everybody to come together, because this fight that we are in is the fight for our lives. And so I'm just so grateful for this conversation, because I don't know about y'all, but I'm at the point of going all the way in. As the old folks used to say in the Baptist church, I'm going for broke. Because at the end of the day, if we can't get serious about this work of justice, all of our lives are in vain. And I'm gonna say that again. If we don't get serious about this work of justice, we can't honor John Lewis and Dr. C.T. Vivian and Pamela Rush and all these folks who have gone on, if we don't continue the fight to change these systems. And we got what we need to make it happen. We just got to organize. As Willie Baptist in our movement say, we got to organize for what we want. And so that's what the Poor People's Campaign is seeking to do.
Absolutely. Thank you so much, Erica. That was powerful. And I told them to let it loose, because I think this is something we need to hear. And I think it's something we need to hear in these spaces. And so thank you, Erica, for that powerful. But you use something, because I think some people get confused with movement. And Al, we were talking about this earlier today. We said, we see what's happening in the streets, which is powerful and necessary in this moment. But that's just one tactic in a larger strategy. So I know you all have to run, but can you talk about the reason this is not just like a one-time thing, that June 20th was a buildup because of people on the ground, and how you really kind of tapped into these, local movements to build a national movement? If you could talk about that, because again, it's about organizing and being disciplined and being strategic in this moment. So you could, Laurel, if you could talk some about that and what you all have been doing.
Yeah, I mean, I'll just say, we publicly launched June and May of 2018. There was a decade of organizing that made that launch possible. A decade, or really a decade plus. I mean, a lot of on-the-ground work connecting poor folk-led organizations across this country, connecting up with the Moral Monday movement, connecting up with the National Union of the Homeless and the National Welfare Rights Movement. All of this work that made that public launch possible. And then that work continues, it grows and it continues. And these moments, like the moment that we're in, where we're seeing these uprisings in the streets, these are really crucial. They are important. These are moments that we must, they are moments where you're cracking open kind of the consciousness of people, and all of a sudden folk are more ready to join movements than they previously were. They're able to be transformed and think about systemic change differently. And so we celebrate them, and we want to make sure we're bringing folks in. But the organizing is every day, and it often doesn't turn out hundreds of thousands or hundreds even. It is the basic work of bringing more people in to the movement. So, the Poor People's Campaign, we're not an organization, actually. We call ourselves a movement vehicle, a movement building organism. We don't have any kind of, nonprofit status. We are made up of people and organizations across the country who have a shared vision for what we need in this country. And we're organized at the state level, so we have statewide coordinating committees. And those coordinating committees engage in nationally coordinated activities like the Mass Poor People's Assembly on June 20th, but they also do just the hard day-to-day work of what we call uniting the base, uniting poor and dispossessed people across lines of difference, which is base building. It is phone calls. It is leadership development. It is sometimes door knocking, not right now, but sometimes door knocking. It is just the hard and slow work of bringing people in, talking to them about what we're doing here, giving them a role to take on, and just keeping with them no matter what's happening in their life. And that's what we mean when we say power building. It's a big word, but in a lot of ways, and most times, a lot of it is just the slow work of building out those who see themselves as a part of this and who are aligned and consolidated around the principles of this campaign and the type of change that we are organizing towards. And that's just how it is. It's tough and slow work.
So I would just
I'm so sorry. I just wanted to jump in and just, first of all, thank you, because I do realize that you might need to leave us shortly. Your words, sentiment, spirit, insight has been just so powerful this afternoon. I'm wondering if you can let folks know how they can support the Poor People's Campaign. I think the moral imperative is so clear, and oftentimes people just need a window in to know how they can support and join.
I'm going to jump off in just about 30 seconds, but I'll just say, go to poorpeoplescampaign.org, click on Take Action, click on State Campaigns. You're going to have a list of email addresses for your state campaign. I saw somebody in the Q&A from Asheville. Look at that, I'm from Weaverville. Say, how do I get involved? You email that North Carolina at poorpeoplescampaign.org. These state campaigns, they're doing open houses. There are ways to plug in regional committees or in other ways. So please just go to poorpeoplescampaign.org and to state campaigns. Thanks, everybody. I'm going to jump off.
Thank you, Laurel, so much.
Thank you, Laurel.
So I guess we did make it to an hour, and I wanted to, Erica, she has to jump off as well. But again, thank you so much, Erica, for coming on. I appreciate you all. Again, they're organizers, y'all, so they got work to do. But I'll be staying on, and if we want to just open up the dialogue to folks, we can have just a dialogue, a speak back. I have nothing else prepared, so just open to having conversation with folks who are on.
So I'd like to jump in with the question, Sherelle. One of the questions that was sent in earlier was about self-care in these times.
Yes.
And particularly as you've so poignantly described the impact of the pandemic on colleagues in the movement. Those are sort of, that's the extreme example, but tell us more about what you all are doing to support each other and to support yourself so that you remain whole in this work.
Of course. So a couple of things. One, I'll say that the committee itself, so we had weekly meetings starting back in March. And so the meeting itself became self-care, if that makes sense, because we were able to join in virtual community, you know, of all the spaces we had to engage in our academic institutions, et cetera. The committee meeting became a safe space. It also became a space where we could vent. It also became a space where we could talk about things, you know, related to the campaign. But so that in and of itself, again, why collective work is so critical, right? So I think sometimes as academics or whatever, we try to take on everything on ourselves, right? And so, but being in collective work with one another, I think those of us who have been doing or trying to do this work long-term have found community or our tribe. And so that's one thing, just the work itself, being engaged in collective work itself can be self-care. And then because it's collective, you know, if you have to say, look, I need to step back for a week or so, there's somebody there that's going to carry your load while you're gone. Again, the power of the collective. And so after June 20th, I took several weeks back to reflect, because this is also a moment where we're just seeing both some of the goodest parts of humanity, the best parts of humanity, and the worst parts of humanity, right? All at the same time. So taking all that in is really, it's a lot. And I think it is necessary to have time to step back, to recognize it is a marathon and not a sprint, right? So again, we jumped in, there were some urgent things that needed to be done and said, but also you can, when you're connected to a movement, you know that even if you step back, the work will continue. But self-care is absolutely necessary. Journaling, writing, however, whatever outlets, you know, people have, you know, tapping into whatever spiritual connections that are necessary. All of that is important for the work to be sustainable. Otherwise, you get burnt out. And so, yeah, so that's what I say, that there is a power in the collective because it actually allows for that, allows space for that, if you lean into it and truly lean into it. Yep. Other questions?
Al, do you have an additional question?
Yeah, Sherelle, so I've known you for a long time, and this has just been so powerful to hear from you today. But I think many of our participants today are in partnerships between academic institutions and the community. And how do you just kind of navigate these academic waters that can be a bit challenging at times, but also always being true to who you are as both scholar and activist? How do you kind of pull all that together, make it happen?
Yeah, I found out early on that it wasn't a choice for me. And so then I had to figure out how to make it work. Like, I mean, it literally was, I can't solely be an academic, and I love the scholarship, you know, and an activist. So I had to figure it out, you know, and it hasn't always got, grateful for this R01 and grateful for the stability it provides. But, you know, that's been a journey of self-discovery and a journey of being committed to this way of doing the work, right? So, you know, not everyone and all institutions understand the work or the necessity of it, but I've had too many experiences in life for me, and I've met too many people, both in my work here in the U.S. in the South, but also work in Brazil, that have just basically shaped me in such a way that I like, if it no longer works for the academy, then I'll leave. And I don't have, and I know I'm saying that publicly, and hopefully my dean isn't on the phone, but like, honestly, and this pandemic has just laid that bare, right? This pandemic is like, if this is not what we're about in public health, then what are we about? You know, like if in this moment where we're literally dealing with the public health crisis of a century, several instances of just horrific police violence that has and for me, so I'll just say, you know, Mike Brown was shot, what's that, 6 years, 2014, the year I graduated from Harvard. Then you have all the other deaths in between. I don't like to name them all. Then you have in Brazil, you know my experience meeting Marielle Franco before she was assassinated. And now this pandemic and Breonna Taylor. So like for me, I'm like, that experience that lines my academic career is almost, it's a moral imperative that I have. Like I've seen too much death and destruction, both in the very vicious ways, but also the daily ways it happens through disease, that I can't do it any other way. Like it's impossible for me to do it any other way. And so I try to stay true to that and try to do good, rigorous research and scholarship, but also remain connected to those who are most directly impacted. And it's a journey, it's a struggle. Sometimes I burn out and have to step back, but I had to figure out the ways to do that for my own sanity, for my own kind of, for just my own existence. Otherwise it wouldn't be meaningful.
So some of our listeners, viewers have asked the question is, how do we really, what does a radical reconstructing of our system looks like in terms of public health, but even more broadly?
Right.
Describe what that would look like.
Yeah, so let's just back up to say in public health, we have this language of social structural determinants of health. We know those things that don't just exist. There are things that produce the policies, the structures that produce those. So when we say radical, I actually don't think they're all that radical. One, healthcare for everybody. Like let's have a system where we have healthcare for everyone. Let's pay people what they deserve, a living wage. Right? We literally had workers who have been making less than minimum wage jobs, without health insurance, without certain protections. They've been working, and then we find out all of a sudden they're essential in this pandemic, right? But they're not getting a living wage. They don't have paid sick leave and those types of protections. How is that possible when they literally carried this economy when the whole economy was shut down? And so living wages, making sure people have health care. We've got to stop placing pollutants in certain communities. Like let's just not do that. What are the regulations we have for putting certain, pollutants in communities? Environmental racism has been around for so many years, and we allow it. We allow it because they're not the regulations and the policies in place to say that these things, or we don't enforce those regulations and policies, right? Making sure that folks have, living wages, Medicare for, healthcare for all, those kinds of things are progressive. Protecting people's power to vote. We have, basically made it so that it's harder now to vote in some places. And so we're not able to engage in the political process to be able to make these kinds of radical changes. Making sure affordable housing is available. We've said during this pandemic that your house is your safest place, but nowhere in this country, in cities, are folks that make a minimum wage able to afford rent. That shouldn't be. Those are the kinds of policies, and there's more, but those are the kinds of things that just are basic human rights. Housing, clean water, healthcare, those types of things. We all say that should be basic and fundamental, and we don't provide that. And it's not because we don't have the resources. Again, one of the things that the Poor People's Campaign does, it works with policy experts that literally have come up with a moral budget that shows where if you take one contract from one of the military contracts away, you could, provide, living wages for everyone. If you take a military contract from another place, you could provide for healthcare for all. Like, it's not that we don't have the resources, it's we don't have the will. And so those are the kinds of things that we're talking about in terms of the radical restructuring, which is really not, if you sit and think about it, everybody should be able to eat and live, have a house, have clean water. Everybody should have that. And so why can't we as a country at state levels and local levels ensure that that's just available to everyone? And again, this pandemic is just the latest example, just laying bare why that's so important.
Yeah, yeah. So one of my good friends, Shantae Keith, I'll acknowledge, actually chatted in and said, isn't it interesting that during the pandemic, the unemployment subsidy of $600 actually equates to $15 an hour. So it's very much aligned with what you were talking about earlier in
Right.
terms of the making these minimal requests or demands that we
Right.
do, right? If it takes that much in a pandemic, right, then it should take that all the time, right, Cheryl?
Exactly, absolutely. And that is just what the poor, like it's the narrative. The other thing is, it's important in this, what the Poor People's Campaign has attempted to do is shift the narrative, because we've often blamed people for being poor, and we put they're poor because they're lazy, they don't work hard enough. But one of the arguments is a lot of the organizers within the Poor People's Campaign work 2 and 3 jobs and still can't make ends meet. It's the working poor, right? And so the fact that in this country, and you have the working poor when literally people are making billions. My dad calls it a pornographic amount of wealth. And I know that's strong language, but if you think about it, the people are making billions, and then other folks can barely survive. And that disconnect, that income inequality, and again, that we see as racialized as well, is what is wreaking havoc on our communities, what's produced the inequities in COVID-19. But Giselle, this has produced the inequities in HIV/AIDS, the inequities in heart disease and stroke. All of the health conditions can be linked back to these inequities in our system that we can address with policy.
Sherelle, as we kind of wrap up today, I want to ask you about the future of partnerships.
Mm-hmm.
Community campus partnerships for health. It's in our name. It's who we are.
Mm-hmm.
We believe in it. I believe in it. I don't believe that any real meaningful transformative change can occur without partnerships. What would you like to see moving forward in these community campus partnerships?
Yeah, I mean, I think that, in this moment, it is, we should probably be thinking about the kinds of partners we typically, are partner with, quote unquote. So, would ask like, are we partnering with grassroots organizations that are, like the Black Lives Matter movement or the Poor People's Campaign, et cetera, right? That, don't have always an explicit link to health, but the things that they're fighting for are actually the fundamental drivers of the health inequities that we see. And so can we reimagine the kinds of partners that we might, partner with and be in partnership with in order to advance an agenda that really begins to push the needle on these social and structural determinants of health and the policies necessary to do that. So I think I think this is a moment where we can do that even the more. Expand the partnerships that we have, maybe some non-traditional community partners that are emerging just even in this moment, right? And so I think that we need to in this moment be examining the kinds of partnerships, organizations that are operating in this moment to really push the needle and push for that kind of radical transformation, that are folks who are really reimagining not just health, but just the systems that produce the health inequities that exist. I really think that's important. I've been in Philadelphia now for 6 years. It's crazy that time flies, but I've been fortunate to in my time here, I didn't jump into engaging with community for research. I just started meeting people, but I've just met some really powerful organizations that do some really powerful work in parts of Philadelphia that folks have wrote off, like North Philadelphia. There's the North Philadelphia Peace Park, and a group of folks who do, organizing along with community gardening and kind of, things around the land here in the city of Philadelphia that's been really powerful. It's an organization called the Village of Arts and Humanities that works with youth, but again, thinking about some radical restructuring of things. And so beginning to work with them, some on research. So there are these, partners that we haven't always tapped into that I think could be really critical if we want to move the needle on, Al, you have that structural inequality training that you're already doing. And in order to address those structural inequalities, you got to get with people who are addressing, are really demanding the change, for those structures. And I think it's also how you connect the dots between the local, the state, and the national, because what we see is that what's happening at the national level is impacting us in communities, right? And so people need to have that analysis of you got to work in local communities, yes, but you got to connect that up to national policies, because the fact that they're not supporting, further testing, or they're not supporting the economic, kinds of policies, that's being felt in community. So we have to figure out also how to engage across the levels of government to bring about some of this structural change as well. So.
Sherelle, I want to say thank you for joining.
Thank you. This has been great. I've been able to reflect, and this has been amazing. This has
absolutely been amazing. And I feel like a lot of people feel such an energy and reinvigorated by you and the community organizers that joined us. And just want to say thank you. And from the chat box, you can see that people are still excited. So there are a lot of Bennett Bells on the phone.
Bennett Bells, how are my Bennett sisters?
So we just want to connect you. So as we close out, again, we want to say thank you for joining us this week. We'll be posting the information about our next webinar. Giselle and I and our team have been, I meant to acknowledge this early. We've been really busy being activists through a lot of grantsmanship activities around really increasing COVID-19 testing throughout the nation and also in North Carolina. And so we hope that will pay off. And our goal is to really take what we know in terms of community engagement and apply that to responding to COVID-19. And so we will be sending that information out to you and all. Giselle, any closing comments?
Well, it's so hard to express how much excitement, joy, and inspiration that this afternoon has really brought to me. I think the comments that you're seeing in the chat box and online really sort of speak to how resonant this time was for folks. I think this is sort of the spark of the injection that we all needed as we're sort of facing another season, our third season, spring, summer, and entering fall in this pandemic, and the weight of that. And so thank you so much for being able to be here with us, Sherelle.
Thank you so much. And I'll just say go poorpeoplescampaign.com if you want to get engaged. There are ways to link into the work, but we need all hands on deck. So just thank you so much for being here, and thank you, Giselle and Al, for the opportunity. It's been an honor.
With that, I think we have our last slide just to remind folks to send us some evaluations. We really take them to heart and have continued to shape our this webinar series based on that feedback. Stay updated. You can subscribe to the CCPH newsletter. You can check out the discussion boards at CCPH's website, and this, as well as all of the other webinars, are going to be posted on both the CCPH website and the CHER website, and you see our Twitter handles there. Please follow us. Make sure you scan the code so that you're able to stay informed. Thank you.
Thank you.